So for the laryngectomized patient, optimal HME use would include wearing the HME throughout the day and throughout the night. Before a laryngectomy, we use our nose as a filtering, heating, and moisturizing station for the air that we breathe in, because dirty, dry, cold air are all pulmonary irritants. And when the mucosal lining of our airway gets irritated, it produces more mucus and makes us cough. So when we use an HME, it serves as a filtering device, a moisturizing device to keep more moisture trapped in the airway, and to also heat the air that is in the airway to produce less mucus. So when a patient uses an HME throughout the day and the night, they'll discover that they have approximately 60% less mucus production. They will cough significantly less, and they can also produce better tracheoesophageal speech by compressing the HME cover. It's important to use HMEs throughout the day and the night, or 24/7 if you will, because this isn't like taking off a pair of glasses or taking out your dentures or taking off your hearing aid. We breathe throughout the night and through the day, and just because we're asleep, it doesn't mean that we should stop having the filtering, heating, and humidification benefit of the HME. It's actually more important to wear it at night because when we sleep, we don't breathe as deeply and we don't cough as hard. And so it's important to protect the airway and to minimize coughing at night, also to produce a more efficient respiratory system so that we don't create a mucus plug. As a speech pathologist who works with over 450 patients having had total laryngectomy, I encounter 3 basic myths when it comes to HME use. So the first one is that if it's not visibly dirty or soiled, that you can continue wearing it. The HME cassette should actually only be worn for 24 hours. It's treated with a sodium chloride solution that helps to retain moisture in air that's inhaled and then exhaled. And so it serves to reduce pulmonary irritants and to reduce dryness, and so that there's less coughing and less mucus production. If the HME cassette is worn for more than 24 hours, it loses that efficiency and no longer functions to increase moisture in the respiratory system. But that's not to say that the HME cassette has to be worn for 24 hours. If the cassette is dirty, if it's soiled, if it gets wet, then it needs to be discarded and a new one put in. So if the HME cassette is washed and dried, the sodium chloride solution is eradicated and the properties of the cassette that improve moisturization in the respiratory tract are diminished. And lastly, a lot of people feel that HME use should only be used if you have financial support or third-party reimbursement to cover the cost of these devices, when actually, if the patient will be consistent in using an HME device, they may find that they have less respiratory complications with less dryness, less bleeding, less pulmonary infections, just because of the heating, warming, filtering properties afforded by the HME.